Okay, all right, thanks all. I'll send you. You're live now, Kat Hamilton.
Good evening everybody, and welcome to the Birmingham Health and Wellbeing Strategy webinar. Before we get started on today's webinar, can I let you know that it's taking place on Teams Live? And if you want to ask questions, can you do so using the question and answer function on the right-hand side? The webinar will be available to watch with the same link, as well as on YouTube and also on Healthy Brum, on the Healthy Brum channel. My name, I did tell you, is Paulette Hamilton, and I'm the councillor for a ward, the Labour councillor for a ward called Answorth, called Solihull. Answorth Wood was my old ward, for those who have known me a long while. But also, I am the cabinet member for Adult Social Care and Health, Public Health, and I also chair the Health and Wellbeing Board. And I mustn't forget, I also cover quite a lot of the wellbeing services. So it's quite a large brief, but tonight we are looking at the health and wellbeing strategy. So as we move to slide 3, today's webinar, I'd just like to thank you for joining us on this webinar to hear more about the Birmingham Health and Wellbeing Strategy, creating a bolder, healthier city. This is our agenda for the session, and I'm delighted that we have Dr. Clara, the interim clinical lead for the NHS Birmingham and Solihull Integrated Care. We also have Professor Graeme, who is the Director for Adult Social Care, and Graeme is also a CBE. So we are very, very happy to have him here tonight. And also the Director of Public Health, Dr. Justin Varney. Now, who doesn't know Justin? Justin is phenomenal, and he does a fantastic job ensuring that the public know what's happening out there. We will go through the health and wellbeing strategy and then to some reflections and questions. Whether you are a member of the public, a healthcare professional, an academic, or part of the voluntary and community sector, this strategy will be relevant and important to you. And it's vital that we hear your views. It's absolutely vital. The role of the Health and Wellbeing Board. We need the slide 4, by the way, the role of the Health and Wellbeing Board. The Health and Wellbeing Board is a statutory committee of the Cabinet, and it's chaired, and the Cabinet is chaired by the leader, and in many local authorities, but the leader has asked me to chair the Health and Wellbeing Board as the Cabinet member for Adult Social Care and Health. Health and Wellbeing, the Health and Wellbeing Board, its primary focus is on reducing health inequalities. It delivers a joint strategic needs assessment, and it delivers and implements the joint health and wellbeing strategy for Birmingham. That is absolutely key. And the Health and Wellbeing Board provides a forum to promote the integration of services across health and social care. The Birmingham Health and Wellbeing Board. On the board, we have a range of politicians. So we have the opposition, so in Birmingham, as well as myself, we have the politician that covers children's services, but we also have the opposition representation. So on our board at the moment, it's Councillor Matt Bennett. We have professionals and we have community leaders from across the system. This includes the council officers, such as Professor Graeme, such as Dr. Justin Varney, elected members, academics, we have the West Midlands Police, we have NHS providers and commissioners, and we have the voluntary and community sector. The Health and Wellbeing Board has 5 sub-forums that are driving the actions at pace across the city. They are focused on creating an active city, a healthy food city, a mentally healthy city, and a city without inequalities and health protection. Previously, Birmingham's Health and Wellbeing Board strategy was agreed, the priorities were agreed back in 2017, and the current strategy aims to build on this, as well as the consultation on the public health priorities for Birmingham for 2019. Ongoing work on developing this current strategy was deferred to 2021 because of the pandemic. These indicators, slide 7, demonstrate the progress made on the priorities and they were prior to the COVID-19 pandemic. They relate to the well-being of children, the independence of adults, the well-being of the most disadvantaged, as well as making Birmingham a healthier city. We will measure our progress on the current strategy against indicators that relate to our ambitions for Birmingham. Slide 8. The Birmingham Health and Wellbeing Board will oversee the Creating a Bolder, Healthier City strategy. The strategy sets out our ambitions for the next 8 years. So it will be from 2022 until 2030, and it will be based on a series of cutting approaches. What we're going to do now, slide 9, is talk about creating a bolder and healthier city strategy. And for this, we're going to bring in Dr. Justin Varney, who will talk through the strategy for us. So I'd like to welcome Dr. Justin Varney to speak now. Thank you.
Thank you very much, Councillor Hamilton. So I'm going to run through relatively quickly the themes of the draft strategy, and this gives you an opportunity to feedback any questions using the Q&A function as we go along, but also towards the end. So if we move on to the next slide. So the draft wording of the vision for the strategy is we have a shared vision as a health and wellbeing board to create a healthier city where every citizen at every stage of their life in all communities can make healthy choices that are affordable, sustainable and desirable to support them to achieve their potential for a happy, healthy life. And what we tried to do in that vision statement is really recognise that health and wellbeing is important at every stage of the life course. We've heard from citizens how much things like cost and affordability of food or of access to leisure services and challenges around access to health services are really important things that are getting in the way of them achieving their potential in life. So that's what the vision statement's trying to say. And that the vision is underpinned by 4 principles for action. So in everything that we do in delivering this strategy, we're committing that we will be citizen focused and informed by citizens' lived experience, consciously focusing on reducing inequality. So consciously thinking about the gaps that exist both within the city, between different communities of place and identity and experiences, but also the differences between the city and the wider region and England. Consciously promoting equality and inclusion, thinking about how as we deliver services or interventions, how do we make sure that our disabled citizens get to use them and they're accessible, or citizens that don't speak English as a first language still understand how to navigate our system and get the help and support they need. And finally, that we will be data and evidence informed and research enabled. And what that means is that in many areas, there is evidence about what to do. And in some places, it's really good evidence. So we know the evidence base around some of the things we need to do with our transport system across the city, or in the way that we engage citizens around vaccination, for example. There is an evidence base, a published research that we can look at. In other areas, no one's got the answer yet. So when we're doing things in this space, we should be research enabled. We should be undertaking research and evaluation to build that evidence base as we move. So they're the principles that underpin our approach. If we move on to the next slide, please. So this roadmap just really demonstrates that at the heart of what we're trying to do in the health and wellbeing strategy is close the gap in life expectancy. Across the city, there is more than a 10-year difference between how long people live in Birmingham and how long they live in England in general. And within the city, we have almost a 10-year gap as well, particularly for men, where some men in different parts of the city will live longer than others. And we need to change that so that we move to a city in which everyone can expect to live a healthy and productive life for as long as possible. Next slide, please. Now, there are lots and lots of things that we can do, and what we try to do in the strategy is really bring this together in a way that makes sense and at least tries to cluster the action around a series of themes that will ultimately move us to a space in which everyone in the city can afford and access a healthier lifestyle that helps them achieve their potential. And I'm going to go through these in detail over the next slide or two. So if we move on to the first bundle of themes, these are really themes which are around the way that we live our lives. So the first one is around healthy and affordable food, and recognizing that food is a really important part of our life. We celebrate through food, we mourn through food, we show love and affection through food. And in the engagement we've already done with citizens, many of you have told us how difficult it is to get healthy food at an affordable price, and that in many parts of the city, there's lots of food around us, but it's not necessarily the food we want to eat or we can afford to eat. So working on the food system being one of the first themes. The second theme is called mental wellness and balance. And the reason it's called mental wellness and balance is that when we talk about mental health, we often go straight to a conversation about what about talking therapy and access to therapy support and medical services like psychiatrists. And we miss off the bit which is around our mental well-being, the bit that kind of becomes before clinical mental health problems. So thinking around how can the Health and Wellbeing Board, as that partnership of different agencies, create a city in which everyone is mentally healthy, that we have more resilience for when life goes up and down, that we know how to look after some of our mental health and do more in terms of that space, rather than this just being a conversation about clinical treatment of mental health. The balance bit is because too many of us get a bit unbalanced when things go wrong, and we turn to cigarettes or alcohol or drugs to try and help us cope with where life is getting difficult. And we need to change that and help people find different ways to deal with the stresses of life, using either things like alcohol more in a more manageable way so it doesn't become a problem, but also avoiding things like cigarettes and drugs, where the damage that they can do to people's health, both in the short term but also with long term, is really serious. The third theme on this slide, and that third kind of lifestyle factor, is around physical activity. Physical activity is like a wonder drug. If we could put it in a pill, it would outsell Viagra. It is the most important thing that can be done after stopping smoking to improve your health. It has a positive impact on people's mental health. It reduces your risk of heart disease, of diabetes. It builds your bones, so as you age, you have a better posture, you can remain independent for longer. And it allows you to live your life in the way you want to lead it. So it really is an important part of what we do. Obviously, next year we'll host the Commonwealth Games, which is a fantastic celebration of physical activity. And one of the things we're linking the strategy to is saying we need to use that and not just see that as a flash in the pan. It's a space for us to really move forward our conversation on physical activity and make sure that everyone in the city is able to be active every day, all of their lives. Because if we're all active, just 10 minutes a day would make a real difference to our health and our well-being, and most importantly, keep us independent as we age. If we move on to the next slide. So these two are moving into a slightly different space for the board. This first one is around contributing to a green and sustainable future. Not quite as wonderful as Viagra, but nature is a really important part of our lives, and green space is an important part of our health and well-being. And through this theme, what we're trying to do with the strategy is make a clear link for people between what we do in the environment of the city and how that impacts on people's health. And under this theme, that includes housing and how we build houses, so we make sure that people have got the space to cook and eat together, as well as how we look after the green space of the city and also the growing spaces of the city, which are really important to so many people's well-being. Protect and detect has two elements to it. On the detect side, we're looking at things like screening and immunisation, sexual health. Primarily, this is about infectious disease, but we're also in the protect and detect thinking about crime and safety. So we've kind of merged those two together so that we didn't have too many themes. But on one side, this is about protecting people from infectious disease. And on the other side, it's about protecting them from crime and violence. And so there are two elements of this theme sitting together at the moment. We move on to the next slide. These three are a little bit more, I suppose, in some senses, more straightforward. They are our three life course themes. And this is because there are some things where we need to think in a slightly different way because we're talking about children as opposed to talking about their grandparents, and how we frame our approach and how we think about what we need to do for children compared to working age adults or for older adults is slightly different. So under the children's theme, really recognising the need to think about pregnancy, even at conception, thinking about what do we do around contraception and early pregnancy to support people so they have healthier babies and happier and healthier pregnancies, through to when teenagers are becoming adults and moving into adult life. And all across that childhood bit, there's a huge amount we can do to give people the foundations for a better life and a better future. Give them the life skills as well as the education to enter adulthood. In the working age adults, which we've called working and learning well, this is really taken an angle around the fact that many people, ill health and poor well-being is a barrier to education and to employment, but it can also, having not got enough education and being unemployed can also cause ill health. So it's kind of two sides of the same coin. But really in this space, thinking about workplaces, employment and adult education, because we recognise that things like adult literacy is a real barrier to people accessing health services and improving their own health and well-being. And then finally in the life course themes, the third one, which is on ageing and dying well. And although people die at every age, we put these two together because the vast majority of us are lucky enough to die in old age. But there are many areas where we can help people to live a healthier, more independent old age. And I'm sure when Graeme shares some of his reflections, he'll talk a little bit about some of the challenges for social care that we have, but also actually how many old people in the city do live independent lives with a very small amount of assistance at home, and that allows them to keep their independence and their choices and their autonomy as we age, which I think is really important part. Moving on to the next slide, these are two of the kind of cross-cutting themes that we thought were important to include. One is around the legacy of COVID. It has been a brutal 18 months. We are still living with COVID, and the challenges of the impacts of COVID, both direct and indirect, are huge. So whether this is the impact of the 3,000 or so people who died because of COVID over the last year, or the hundreds of thousands who've been infected by COVID, or the million citizens who've been impacted by the restrictions and the impacts it's had on our mental well-being and our sense of connection with each other and with partners. We need to think about that actively because it will play out not just now, but over the next 10 years. As I said at the beginning, one of our principles is on equality, diversity and inclusion, and we've included it as a specific theme, though, to give us a space to highlight particularly inequalities linked to communities of identity, that's predominantly the protected characteristics, but also to communities of experience. So these are communities where people share a common experience, but they may not live in the same area and they may not necessarily identify that way unless there are. So for example, people who've been through our care system as children, or people who have been in contact with the justice system would be communities of experience. And then the final slide just highlights that this kind of theme that runs through everything. If you remember on the original diagram, this is this kind of purple arrow, purple circle that sits through it all, which is around closing the gap and really trying to identify in the strategy 5 areas where we've got a specific focus on inequality, and through the board really honing in on at least one indicator and one area of action under each of these 5 inequalities. So one linked to deprivation, which is poverty. One linked to disabled communities, because the board really recognises that, you know, there's lots of discussion around various other inequalities, but actually as society we're not very good at talking about how challenging it is for many of our disabled citizens and many of the barriers they face. One on what are called inclusion groups. So those are those communities of experience. I described the homeless or our sex workers. They're a specific definition that the NHS recognises, which is why we use the term inclusion group. Inequalities of different ethnic communities, and the work we're doing on the African and Caribbean Health Inequalities Review is really already helping us as a Health and Wellbeing Board start to think differently about how we talk about ethnicity and inequality, and getting us into some really challenging and interesting discussions about trust and respect, and understanding that, you know, we use this term ethnicity to cover thousands of different identities, and that is not good enough, and we need to think more deeply when we talk about this. And finally, the inequalities of place, which brings me back to that map of the city, the tram lines and the train signs, and the fact that in the city of Birmingham, a man living in one part of the city will die 10 years younger than a man living in another part of the city, and that is not okay. And that's a fundamental piece that as a board, we are committed to closing those inequality gaps and really addressing it so that everyone in Birmingham can at least look forward to achieving the same length of life and hopefully the same quality of life as every other citizen of our city. So I've run through that at a relative pace, but I hope it gives people an overview of the strategy as it's going into consultation and a bit of sense of what's going on. And I'll hand back to you, Councillor Hamilton.
Right, thank you, Justin. Can I just add, before I bring the partners in, Justin hit on a really crucial point. When you try to make change, when we talked about ethnicity and the changes, even somebody like myself, who's a hardened person around change, I want to see change happen. Even I became a little bit nervous. Oh my God, what will this mean if it backfires? So for me, this strategy needs to be bold, we need to be fearless, we need to be committed, we need to be driven, and this strategy needs to be bought in by not just the Health and Wellbeing Board and Justin and myself, but by the partners. So at this point, can I ask Professor Graeme Betts, if you could give your reflections for me, and then Dr. Clara will hand straight over to yourself. Thank you. Graeme, over to you.
Okay, thank you very much, Councillor Hamilton. So I will be brief because I'm sure there's lots of questions we're going to get. Just a few observations and reflections as you've asked me for. I'm pleased that the vision is underpinned by a focus on reducing inequalities and promoting equality and inclusion. I mean, that's very much at the heart of what we do in adult social care. Above all else, adult social care is about social justice, and these areas, you know, are absolutely central to what we do. And of course, the life course themes, working and learning well, are critical as well in all of this. I think we're all well aware of the importance of employment, you know, wages and so on. They're just critical, and I'll touch on that again in a minute. But again, it's an essential life course theme that we need to see. As I've said, disability, for me, the groups we cover in adults, people with disabilities and older people, is very much about social justice, and just to show how profound the challenge is. I mean, I think as a society, we don't value people with disabilities or older people in general, and we don't value the people who work in the care industry and meet their needs. And I think that's a fundamental challenge that we're obviously addressing in adult social care as part of our work on social justice, but it's something that I think needs to run through this health and wellbeing strategy. And just as an example of that, in terms of the workforce, I mean, there are 33,000 people working in care in Birmingham. It's a huge number of people, and the vast bulk of those are on really very low wages. You know, so it's a big challenge for us. I think the other things I would mention that we're doing in adult social care that fit with this broad approach to health and wellbeing strategy. Two things I'll mention. Firstly, prevention and early intervention. It's something we believe in at all stages of life. We've invested in this in adult social care in terms of building and developing community assets. So in other words, we try to make services as local as possible, and we try to, we don't wait until people are in a crisis. We try to intervene much earlier. And our whole social work approach now is based on a strengths-based approach, where we work with people, we have conversations with people about what they want to achieve, what outcomes they want, and how we can support them using these community assets to achieve them. So that's one big theme for us, which again I think fits very well with a broad approach to health and wellbeing. And then the second one really is what we call preparation for adulthood. I think for parents with children with disabilities, they often talk about falling off a cliff, and that's what we're really seeking to avoid. What we're trying to do is to reach, as an adult service, back into children's services, so that we work with children and young people at a much earlier age, and really begin to get them thinking about their goals and outcomes that they want to achieve as adults. And I think again, it's essential we see ourselves as joining up these pathways, seeing people as part of families rather than as separate groups which get all sorts of different treatment. So that's again another area that I think fits well what this health and wellbeing strategy is seeking to achieve. So I believe that the work we're doing fits very well in terms of supporting the aspirations and goals and the vision, which obviously I was delighted to see. And I think if we can do all of that, we can contribute to closing the gap in inequalities, which has got to be a key target for us in Birmingham. Thank you very much, Councillor Hamilton.
Yep, absolutely fantastic. Dr. Clara Day, I'm going to move straight on to yourself. If you could just help us with the NHS or primary care type perspective. Thank you.
Thank you, Councillor Hamilton. So although I'm here as the interim clinical lead for the integrated care system, I'm actually a kidney doctor during my day job, and a lot of what we've talked about here is incredibly relevant to the people that I see all the time. There is unfortunately patients with kidney disease struggle to access activity, to get the foods that they need, and unfortunately people who are poorer are more likely to get kidney disease as well. So you can see this reflecting all the way through. So as a doctor, the NHS is completely overwhelmed at the moment, as we know, it was struggling before COVID, and as we're coming out of this, as Justin says, the legacy around COVID for our whole city, and including our health services, is massive, and just reminds me so much how important it is for us to address causes of ill health before we get to them. So the active city and the focus around food and indeed around prevention is incredibly important, but not only for people to prevent disease in the first place, but also to keep people well as we can who've already got chronic diseases that they are living with, long-term conditions. And I think that focus on mental well-being equally is incredibly important, because we all know that COVID has been very difficult for a lot of us, but again, people who live with long-term conditions as well struggle with their mental well-being a lot of the time. So I really welcome this focus on wellness, as opposed to the National Health Service, which could probably be called a National Illness Service at the moment, because that's what we deal with as opposed to health. So I really welcome that kind of bold statement around prevention. I've worked on the vaccine programme over the last few months for COVID, and I think we need to build on the momentum around that to encourage all vaccination, really, not just the COVID vaccine that we've done. We've traditionally not been great for flu either. We need to build on that, and also childhood vaccination to keep, infectious diseases as low as we can. I think if people had forgotten how inequalities affects people from a health perspective, COVID has brought that very, very clearly back to all of us. And we saw how people who were less well off and who lived in houses with a lot of occupants, or didn't have jobs, who could work from home, or indeed had jobs that disappeared during COVID, have suffered hugely during this pandemic. Those are the people who are more likely to get ill, more likely to end up in hospital. And again, that reminds us all, if we had forgotten, which of course those of us who practice medicine all the time are very much aware of, as to how important inequalities are for health. And I would really reflect Councillor Hamilton's reflection around the different ethnicity groups that we again picked up a lot within the COVID vaccination programme, around trust and relationships in communities around health, which is something that we all just need to work together to enable, I think. And then just one other element that Professor Betts talked about, we employ in the NHS in Birmingham, even more than in social care. And there's two aspects. One with that is to make sure that as an employer, we are emphasising this strategy, because a lot of our employees live within Birmingham, so to make it easy equally for them to be active and to eat well and think about mental well-being, but also for all our patients that we are having contact with, because they're coming to see us, that we need to make every contact that we have with patients across the city to emphasise these strategies that you've got about health and well-being equally, because we as healthcare professionals have an enormous amount of contact with patients as well. So I'd really welcome this strategy is put together, and thank you for asking me to comment.
Right, thank you so much for that. I've really found the reflections really helpful, and what I'd like to do now is just look at some of the next steps before we go into the questions. 1 second, I've just made a boo-boo. The next steps. 1 second. Right, so what's next? Now, for me, this is not going to work if we don't hear your voices. So we need to hear your views. You still have time to make your voice heard and to develop the strategy with us. This cannot be something that is a whole system approach if we're not in this together. So we want to hear your voices. This is a draft strategy, and it's actually out for consultation. It can be found on the Be Heard website, or by Googling Creating a Bolder, Healthier City. Now, I'm pleased to say that we have a couple of questions. So let me start with the first question, which I can't see. So can I ask, where are the questions?
If you go to the published,
yeah,
in the QA, you'll see the ones that are published.
Brilliant, 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 brilliant. Given the huge amount of research highlighting the very significant impact of early childhood adversity, including mistreatment, abuse, neglect, disrupted attachment, relationships, family dysfunction, developmental trauma on physical and emotional health, is there a reason this is not mentioned or reflected anywhere within the strategy, nor the need for more trauma-informed approaches in the service design and delivery across the city? Now, Dr. Varney, I'm going to go straight to you because that is fundamental, actually. That question is fundamental. Thank you.
Yeah, so it is in the strategy in the sense that it's in the section on children and the life course section around children. And if you feed into consultation, if you feel it's not clear enough in the wording, one of the things that we've really wrestled with in this space is what this person's described is what are often called adverse childhood events, or ACEs. And there's a real tension between working on these issues, and we work very clearly as a partnership through the child safeguarding arrangements and the child safeguarding board of the city who take the lead in this space, and not labelling children as damaged or broken. And I think that's an important piece to just think around this. And actually, that's where things like more psychologically informed approaches to trauma are really important. And that is work that the Children's Safeguarding Board leads on. So what the Health and Wellbeing Board's job is to link with the Children's Safeguarding Board, but not to do its work for it, if that makes sense. So as from memory, it is in there, but it's not in there as a headline piece of work, because that work is very much led by the Children's Safeguarding Board, who are the kind of lead partnership agency for delivering in this space. Doesn't mean we're not aware of it, doesn't mean we're not acting on it, but we're following their lead rather than this being something a Health and Wellbeing Board pick up as their kind of primary area of focus, if that makes sense.
But Dr. Varney, do you think this is an area that perhaps we could strengthen, because the focus at the ICS level, as well as the children, Andy Coldrick's neck of the woods, is so passionate about this area? Perhaps we could find a way to make it more explicit. I am going to bring him, if he's willing to answer, Professor Betts, but I'm going to bring Dr. Clara Dane first because of your role with the ICS, and then Graeme's role with the place agenda. If you feel there is anything we're lacking, or as professionals you feel that more could be done in that space. Dr. Day, you don't have to answer if you feel it's out of your comfort zone.
So, I mean, this is not my area of expertise either as an adult doctor, but what I would say is that one of the things that all of us on this call will be working towards over the next year or so is how we make sure we join up all the offerings from health and social care across the city to feel more of a package for people, rather than having this area and that area and that area. And that's the aim of the integrated care systems that will come in April. And that will take some time for us to do, but I think we've all got an ambition now to make sure that we join up these approaches. And if a particular agency is not able to offer support, then we know where to go to signpost people for it, rather than all of us saying, we're not sure. So that we're offering a package of health and social care to people who live in Birmingham, rather than patches in our own specific areas. So I think that's probably all I can say on that.
Which makes sense. And the reason why I asked Justin if we couldn't strengthen that area, I absolutely agree with Dr. Varney. It is not our specialist area, but what I do agree, it's one of the major targets of the council. So even if we're only monitoring what is going on, we need to ensure that it's clear in the strategy that that is what we plan to do. So it's just a point I'm raising, Justin, but I'm just thinking on my feet. Can I go over to Dr. Betts? not Doctor, Professor Betts.
It's okay.
I want to call you Graeme, but it's not very professional.
It might be easy. Thank you, Councillor Hamilton. Just to add a couple of points, I touched earlier on in my reflections about preparation for adulthood. I think the thing we always have to bear in mind is that, but you know, and it happens in all cases, children grow into being adults. You know what I mean? And that means when we're dealing with adults, we have to think about their childhood, and that, you know, is something that I do hold as a very important tenet in the way we approach things. Just because, you know, we focus on adults doesn't mean to say that we don't want to engage with children's services and as I said, develop that pathway so there isn't, you know, you're a child, then mystically you're an adult, you know, and services all change. We've got to find pathways through it. And certainly when I worked in Rotherham, what really struck me there was that we'd begun to see children who'd been victims of, you know, grooming and all of those things. And really, we didn't have the tools in adults to manage this. It was the damage that had been done was so profound to their mental well-being and so on that we really struggled with what we had in adults. And that's where the notion of the, you know, developing teams like the vulnerable adults team, transitions and so on, we really strengthened that in Rotherham because we could see the need for that pathway. And I think that's what we've tried to introduce into Birmingham as well. And the idea being obviously that you get the value from what children are doing and children's services are doing, what adult services are doing, to make a coherent pathway to help mitigate the damage that's been done. And the second thing I think that goes alongside this is in adults, I've talked about the community asset approach. So I mean, we're very much about community-based assets and so on. And during the pandemic, we invested through the Children's Trust into children's services as well in the community. So we strengthened that whole area as well and have begun to join up so that the community assets we're developing are all age rather than being focused on different segments of the population. And I think that again is useful when you think about the impact of ACEs, if that's what we're talking about, that you start at an early age and you work things through, you base it in the community and you begin that the services there as they grow into being adults. So I do think the work that we do in adults does, you know, sit well with this. It is important that it's joined up and it will certainly help to mitigate the damage that's been done. And I think Clara's right. I'll use first names if it's all right, Clara. But I do think it's, I think you're right about the ICS. This is an opportunity for us to do things differently. I really hope we can take it, you know, and I mean, above all else, it's meant to be about a partnership at a level of a place. So I think there's a lot we can do in this area to take that forward and again, help to address the challenges we face as outlined in that question. Thank you, Councillor Hamilton.
That's fine. And as you remember, Graeme, the one thing when we were developing that transition service, we've always known if we can get transitions right, one, the expectations of our parents, they would be more relatable. Two, it will be a more affordable service. And three, the shock that our young people and parents have when they go over to adults and we don't provide the services. Sometimes it was managing expectations. So you're spot on. You know, Justin always tells me about the life course. In public health, they always talk about the life course. And I do think, especially with the ICS, we are now starting to see that people are looking at the life course, and rather than looking at an age, which is only a number, as it's my birthday today, it's only a number. Rather than looking at the age, we're looking at the person in the place where they live. So it means we are able to deliver more holistic services. So I do think that it is important that we have it there somewhere, which I agree with Justin. We have actually got it, but it isn't explicit enough. So it's something we just need to look at. Justin, do you want to come back in, or do you want me to throw this other question at you? Are you?
Yeah, I think go on to the next question.
Who delivers the strategy to the public? Justin, I'm going to go back to you for that one.
Yeah, so and if I pick up also the question about how can citizens be involved?
Yeah.
So there are two things. One, the consultation is still going on at the moment. So you've got until the 10th of December to feed in your thoughts and go through the Be Heard platform. And we also have, through all of the work that underpins this. So, for example, in the work we've been doing on food, we've been doing citizen engagement. We've been working with a partnership of community organisations like the Real Junk Food Project, like the Active Wellbeing Society, who are working with citizens, and they're bringing people's lived experience and voices into the room where we're kind of working out so what are we going to do space. We've also been working with the youth champions of the city. So each of the subgroups of the Health and Wellbeing Board have young people on the subgroups, and they're supported by a youth worker to be part of it as well. So we've got a kind of program around how we move from the strategy into action plan, and that action plan being very much developed and co-produced with partners, including the community voluntary sector, represent citizens. The delivery of the strategy is through the partnership of the Health and Wellbeing Board. So one of the pieces that we're doing during the consultation is working with the NHS, with the new integrated care system, with the community and voluntary sector, with the business sector, and with the universities of the city, and also with the hospitals that are providing services and the GPs around who leads on what. Because this is not a council strategy, it is a Health and Wellbeing Board strategy, and different bits of it will be delivered by different people and funded by different people across the Health and Wellbeing Board. This is not the council paying for everything, and it's not the council doing everything. So the key bit is, as we are in this phase of pinning down what do we want to do, how we deliver it is the piece that then starts to evolve, and that's through the subgroups of the Health and Wellbeing Board and those partnership groups that are already in place that bring everyone together.
So Dr. Varney, how do we know that the strategy is working over the next 8 years?
Yeah. So there is a data pack that goes alongside, as Councillor Hamilton knows, I love a bit of data. So for each of the things that we're saying we want to achieve, we have got a metric. So we've got a piece of data that we're able to track. Now, some of those will change quickly. So if we look at, for example, how many citizens across Birmingham are regularly taking part in physical activity, we get fresh data on that every 6 months because of a national survey that Sport England fund with the Department of Health. So we can monitor that, not quite real time, but pretty frequently. If we look at a bigger challenge, such as infant mortality, where we are trailing really badly across the country, over 200 babies in Birmingham die before their first birthday, and that's not okay. We need to really change that. That data takes about a year until we get it for the previous year, so it's about a year out of date. And we know from other areas that have worked on this, it takes about 4 or 5 years to make a real difference in those numbers. It's not something that changes overnight. So what we've done through the strategy is for each theme, we've got some headline indicators, and we tried to get ones that are short term that we can monitor in real time or near enough real time, and some that are long term that we know will take a couple of years to change. Ultimately, the end of 8 years, what I would like to see as Director of Public Health is that the gap in life expectancy for the city has not grown, because all of the things that are happening in the economy around us as a country, but particularly in Birmingham, the impact of COVID, I would expect that gap to grow. So if we can stop it growing, that would be good. If we can shrink it, that would be even better. So that's the headline. If we're looking at what judges us on what's good in 8 years, we will have stopped that gap growing any bigger for life expectancy in the city, and hopefully we will have shrunk it. And then there are lots of other things through the strategy where we hope will have an impact, and we'll be able to measure that.
Right, excellent. I've got a question for Professor Betts. I'm a great believer that any strategy we do as a council, it needs to be joined up with what the rest of the council is doing. How do you feel we can achieve that through this strategy that we are currently producing?
Thank you, Councillor Hamilton. Yeah, I mean, I think it's an absolutely fair point. I mean, health and wellbeing impacts upon everybody in Birmingham. you know, whatever age. So it's something that we need to make sure we respond to in that way. Equally, to achieve improvements in health and well-being, we need to focus our energies and our services on addressing the inequalities and challenges we face, and we need to work with our partners beyond the council services itself. So just as an example of that, and just, you know, in terms of how we've tried to do this for you older people, there's obviously a core range of services that adult social care deliver and commission and so on. But for us to achieve the outcomes that we set out in the vision, which are around good quality life, being happy and all of those things, we need to ensure that we are working with our partners in housing, in community safety, transport and so on, to make sure people can achieve those broader outcomes. So the answer to your question is we need to see this as a starting point to work more effectively with our partners outside of the council, and making sure that all the directors within the council see improvements in health and well-being being core to what they do. And, you know, if you wanted to take it down further, there's no, in my mind, there's no reason why we wouldn't set performance objectives for each director and each directorate within the council. Otherwise, you know, the risk is it becomes Justin's baby, which is, you know, not what we want, or, you know, seeing it as something that NHS does. I mean, I've spent my career making clear health and inequalities in health and addressing them. It's not about the NHS, it's about what we do in broader society with our partners in the NHS. So I think that's the answer, Councillor Hamilton.
Thank you. Now, there's a question here that Justin has started to answer, but I wanted Justin to answer it, but I wanted Dr. Day to actually have a stab at it. Infant mortality is a major contribution to shortened life expectancy. I have lived in Birmingham for 30 years, and the gap between our infant mortality and the national average has not really narrowed. What are the features of the current plan which make us feel more optimistic that this time there would really be more progress? Now, how I'm going to ask you to frame it is, as part of the ICS, what would you like to see in the strategy to help it frame what this anonymous person is talking about? Then Justin, I want you to come in and tell us what as a service we've been looking at doing and we've started. Does that make sense, Dr. Day? Thank you.
Yes, thank you, Councillor Hamilton. And I'm lucky that Justin has already typed an answer in as well, so I'm cheating slightly. But, I mean, I think that the really key things are, first of all, this is a really key thing for us, as Justin has already said. You know, it's you know, a real marker of inequalities for our system, this infant mortality issue. So one, it is a priority, and two, it's about people coming together for a joined up plan to address that priority, and that will include all sorts of aspects. What we know works well somewhere else, so that we're not reinventing wheels, but adapting it to our communities, so that it's not just lifting it from one area and dropping it into our area and expecting it to work. For NHS partners to have their ideas as about what are the key things that help prevent infant mortality, but joining that up much wider into the community aspects of inequalities, because the NHS is about healthcare, and there are far more aspects that affect, you know, poverty and infant mortality than just healthcare. So it's an absolutely key example for me as to why working together better within an integrated care system is really important, because you can't do it by yourself. You can't just do it as NHS, you can't just do it as community, you can't just do it as academics. So that's where I would say it's that willingness for us all to own it as Birmingham. We say, we are Birmingham, we want to do this together because it's so important. And then we work through how we're going to do that as a team rather than in individual blocks.
Now, just Dr. Varney, you beat me with the answer on here, but what I'd like you to do is yes, answer the question, but I'd like you to extend it. We are looking at having health and wellbeing boards and integrated community partnership boards. How do you see this fitting into all of that going forward? And thank you for that, Dr. Day. You're actually spot on, but thank you for that. So over to you, Dr. Varney.
Yeah, I mean, infant mortality is a really good example. So the person who wrote the question is quite right. 30 years or so, Birmingham's been some of the worst in the country. And there hasn't been from what I can see, a really clear strategy for how we change things. Yet there has been quite a lot of evidence of what do we need to do differently. And what we need to do differently requires the NHS and the council and the voluntary and community sector working together. This isn't something the NHS can fix. Yes, there are some really important bits that the NHS has to lead around genetic counselling, genetic screening, around antenatal care and making sure that our maternity services work well for all women, and that are addressing the needs of what women and parents need around their pregnancy, and that we're making sure in that first year of life, our health visitors and our children's centres, the Council Commission are working as part of a system and are really wrapping themselves around the most vulnerable children, but also making sure that all parents and children have the support they need around things like safe sleeping, which sadly still costs too many children their lives in our communities. So by bringing together the task force, and this is being led by a lady called Professor Shushma Cllr, who actually, when I was first training in public health, was my trainer. She is very, very experienced public health specialist with a particular interest in this area. So she's taking on the chair of the task force for us, and as an independent person, is going to make sure it delivers. So she's passionate about it, but we brought in someone to add that extra little bit of grit to this. I think on the point of the ICS, how the partnership board and how the primary care networks work with us on this is going to be really key, because this will only work if this is threaded through to the whole of the way that we work as a system with parents, particularly with pregnant women and with children in that first year of life. And that means we've got to think about what happens in a GP practice, from what the receptionist says through to what the midwife does in the hospital, to the obstetrician if they're involved, and to what the pharmacist gives as advice over the counter. We've got to think about the whole system. And I do think at the moment we have got an opportunity to do that slightly differently. And there's some green shoots. Some of the work that's happening in Washwood Heath at the moment with the ICS, where we're bringing together the local politicians, the police, the GPs and community representatives to really talk through how can the system in Washwood Heath around primary care work better for people, is the kind of green shoots of what we're going to see, I hope, with the ICS moving forward. But this is one of those things that, you know, as Councillor Hamilton, remember, when I came to Birmingham a couple of years ago, I was like, we need to fix this. We need to do this differently because it's gone on too long. COVID's got in the way and slowed us down, but I'm absolutely committed. This is something we are going to make a difference on, because it's just not okay that we're losing those 200 babies that could go on to have happy and healthy lives. And that's too big a loss for the city to bear.
Thank you. There's another question here, but I'm a bit loath to ask it, but I will. How are you measuring working together between the ICS and public health? They specifically said public health, but I would have said with other parts of the council. It's not just about the ICS and public health. If that's what we do, it's wrong, and I'm going to declare that. We have to be, as a council, there are lots of other departments in the councils that the ICS should be working with, and housing is key, but at the moment it's not round the table. So for me, I'm going to ask Graeme to answer that first, and then I'm going to ask Clara if she wants to add anything, and then Justin, you just round it off for me. So Dr. Betts.
So thank you, Councillor. I mean, the thing is, it's early days for the ICS. It hasn't been properly constituted yet. So what we are doing is beginning to put in place what we think is important that the ICS will do and deliver and achieve and so on. But we're at the early stages of working out what that'll look like, and once we get that in place, then we can think about how we measure it. But what I think the sort of things that I would want to see us measured against are improvements, in terms of better outcomes for our citizens. I mean, some of that will be, the measures for infant mortality, those sorts of things, as well as more broader things. One of the earlier questions was about community assets and so on. So seeing more people engaged in programmes around care and health and so on. Again, I would see as other measures of successful working together between the NHS and the various elements of the council and the community groups. So I think there's a lot we can do to measure, that will be working, that will demonstrate how we're working together more effectively. I think it does need to be a range of things, not just hard measures, but also the softer ones as well, which will demonstrate that we're actually getting to grips with improving the outcomes that the ICS wants to deliver for its population in Birmingham.
Thank you. Dr. Day?
Thank you. I mean, I think one of the few benefits of COVID is that we have all had to work much closer together as a community of health and social care and public health, and that we perhaps didn't before because we didn't have that desperate need to do so. So I think that we are working much closer together than we ever have done. And as Professor Betts says, that's not actually formalised until April from a kind of organisational level, but we're working our way towards that. And I think that there is a recognition far more, again, because of the huge differential effects of COVID across our city, about how important it is for us all to work together to address inequalities in health and in all other aspects. And that requires us all to work together. And as Professor Betts says, there will be some hard measures around outcomes, but one of the other things that we probably have to do is work out for citizens what's an important measure of us working together better. So how does it feel better? And again, that will not suddenly switch on April the 1st, but it's how over time we are able to make things feel better, as well as actually measure hard outcomes like we've been talking about, life expectancy, like infant mortality. So it's that experience of people that I think is really important for me as well.
And can I add, before I bring Dr. Oh, you want to come back in, Graeme? Let me add my bit, then Graeme comes in, and then Justin, you will round up. I believe we have been working together, and sometimes we've not actually looked at some of the really good work that we've been doing, the Section 75 agreements that we've got out there with mental health and some of the disability services, the work we've been doing with Better Care Fund, the work Justin and his team have done related to drug and alcohol, sexual health, where we've commissioned the contract, but we've been working with the health service. What I'm trying to say is what we need to do is look at what has worked well, perhaps what has not worked as well, and how going forward in this brave new world we can help to iron some of those things out. But for me, things like in my community, I'm a Black woman, diabetes is horrendous. For me, if we could get something like diabetes care, that we know what we're doing within the communities so that we can get that preventative work going on, and it's not always about being reactive, it's about being proactive. I actually think it's a start. So for me, we need to look at some of the good work that's going on, but also highlight a couple of the areas where I think we could get some quick wins, really, if we could just pool things and get things going to actually show the system what you've said, Dr. Day, that we have been working well together, because a lot of our residents and a lot of the people who are questioning us, they don't actually see that, but that work is going on in the background. So I'm going to bring Graeme in, and then Justin, you will answer anything I've forgotten. Thanks.
Great, thank you very much, Councillor. Yeah, it was just really Clara sparked off a thought in my head, which we will be doing. I mean, we have been working, very hard, as you know, Councillor, over a number of years to improve early intervention so that the flow into, through and out of hospital is much improved. We know, if I go back to when I first arrived in Birmingham, we had some of the poorest performance in the country. And what we've done is work together to improve it. And we're now at a point where, if I had the graphs on there, I could show them and you would see the dramatic improvements we've made. And I think that's what sparked it off in my mind, is there's a lot of things we can now build upon, which is, as you say, Clara, has been in some ways forced upon us by the pandemic, and other things we were working towards anyway. But there are measures we can build on. And the other thing I think is important is, rather than just measuring how many beds are blocked as we used to do in the past, what we're trying to do now is look at the outcomes. How many people return home, re-abled to be able to continue their lives as the way they were before they went into hospital. And it's measures like that that I think are going to be really important that we get a good handle on and develop going forward. So I just really sparked it off in my head, and I think it's worth making. And then the other thing, very briefly, is some of the early papers we prepared on place for the ICS talked very much about building on people's lived experience of health services and care services, as you've both said, to rightly bring right to the centre people's experience of what we do and how we do it, so that we can begin to change it and create something which more accurately meets what they believe they need to improve their health and well-being. Thank you, Councillor.
Thank you, and thank you for that. Justin, Dr. Varney, over to you. Thank you.
Yeah, so I mean, I think there's not much to add. I think colleagues have covered it well in terms of how we measure success. Ultimately, I think we measure success through the impact we have on citizens' lives. But I think the concept of working together, as the question's phrased, is we measure the success by actually avoiding duplication, about building on the strength of each other, and about having an impact. And I think, we've all worked together, the four of us who've spoken tonight, through the COVID pandemic since the early days. And as Clara mentioned, Clara led as medical director for the immunisation and vaccination programme of COVID. There's been a huge amount of joint working, and it's required humility on all sides. There are times when it's been about saying, look, the council is best placed and has the relationships with communities to have conversations, and the NHS is better placed to lead on how you actually put jabs in people's arms, and there are some quite techie bits about how you keep a vaccine viable that we need to butt out of and let them get on with. And the true measure of whether the ICS and the Health and Wellbeing Board are working together is that we work together in honesty and authentic partnership, and that we build relationships of trust. And I think, as Councillor Hamilton said, we've got lots of great foundations to build on. There's lots of stuff that in Birmingham we're not great at telling the world about. Yeah, actually, some of the work we've done in our partnership work on vaccination is held up nationally and internationally as best practice for actually how to work with communities and think differently. Some of the work that Graeme's led around early intervention to avoid people ending up in social care and ending up in hospital, again, is held up nationally. But we don't really talk about that with citizens. So I think it's, the proof will be in the pudding. Whether we bake a better Birmingham together is up to whether this partnership is really delivering the goods, and it will be up to you as citizens to hold us to account through Councillor Hamilton, and if we're not delivering for you and it's not making a difference in your lives, because we all do these jobs because we want to make a difference. That's what being a public servant's about. The long hours are certainly not worth it for the cash. So we are here to make a difference, and that's what this strategy is about. And I know someone did put one of the comments earlier about they wish more people were listening. We will be putting this out on YouTube and stuff so people can see it. As we've shown through COVID, when Birmingham comes together, we work as a city and we work as a partnership with citizens, and where you can make a real difference. What we've got to do is take that and apply it to things like infant mortality and smoking and life expectancy, and keep that energy of we're in it for Birmingham and we're in it together.
I think you've answered the last question that I was going to pose. So unless you wanted to add anything to that last question, it said, Dr. Varney hinted that because of the economic impact from COVID, things could get worse for infant mortality. What are the other important areas where we expect similar impacts from COVID? Is this factored in also when other targets in the draft strategy are set? Justin, do you want to tackle that one?
Yeah, I'll give it a brief answer to that. So ultimately, I think in almost every area of the strategy, COVID will have an impact because it's just affected all our lives. And whether it's affected it because directly, because we've been ill, we're left with long COVID, or it's through bereavement and the impact on mental health and well-being and what that has done for some people in terms of their relationships with drugs and alcohol and cigarettes, and made it harder to give up addictions and find balance. It's changed our relationship with the environment about us. You know, I certainly learned more about the bit of Birmingham I live in during the pandemic because I was only allowed to go on a short walk outside. So I really do understand the geography and the space that's there and how to use it. So I think it impacts on all of this. I think one of the reasons we've set the strategy as starting for next year is I do expect we to see some of these targets will get worse before they get better. And that's why it's an 8-year strategy, not a 3-year strategy, because the impact of COVID will be pretty profound and it will probably take 2 years to really play out through all the data. And then we'll start to see the impact coming through. My hope is when we came into this pandemic, we were predicted over 9,000 deaths in the first wave as the worst case and 3,000 in the best case scenario for the first wave of the pandemic. To date, we're just up to about 3,000 deaths. And that's a reflection of all of the hard work of the council, the NHS, the community voluntary sector, you as citizens playing your part and making a difference. My hope is that will pay out also in the impact of COVID on our citizens and we will fare a bit better than expected, but we will find out in the next couple of years, and we have factored it into the thinking about what our overall target and trajectory is, because I do think it will get worse before it gets better in the numbers. My hope is that we are already getting stuff moving to try and mitigate the impact on people's lives.
Thanks for that, Justin. Dr. Beck, Professor Beck, keep calling you doctor. You may be having a doctorate soon that I don't know about. But anyway, Professor Betts, have you got any closing words or thoughts? And Clara, yours will be last, but by no means least.
Just picking up that theme. I mean, COVID has had a profound impact, and in a whole range of ways. And certainly, we've seen it, in adults and in particular in mental health, domestic abuse and so on. So there's a whole range of ways. But I think the other thing is it did remind us and highlight the stark inequalities in our society, the stark inequalities in the workforce and so on. And we've certainly responded to that by making sure that a principle for us going forward is about reducing inequalities, about improving social justice for our citizens and also for our workforce. So, it's the old thing, out of, a crisis, good things can come if we're prepared to marshal ourselves, and work together to address them. So that would be my final comment.
Thank you, Professor Betts. Dr. Day, any final thoughts before I do the closing statements?
Well, just really to echo what people have said, and as Professor Betts says, out of COVID has come the focus back on inequality, but also out of COVID has come this, recognition that we can be better together than apart across the system. And hopefully we can take that forward to think about a whole pathway, as Justin has said, from birth, pre-birth through to death, but also across the whole of society to try and work together to help improve health and care. And, thank you for asking me to comment tonight.
Fantastic. Now, I'm going to sound like the old nagging mother that I am. And I'm going to go back to the point. This is actually a webinar that we're looking at a consultation. The consultation is around health and well-being. It's the strategy. I really want to hear your views. We want to hear your views. There is still time. Please make your voice heard, and because we want to develop this strategy in conjunction with the community, other partners, and anybody else who's interested. The draft strategy and the consultation can be found following the link for Be Heard, or by Googling creating a bolder, healthier city. Now, can I find out from Justin, when does the consultation close?
10th of December.
Brilliant. I did know that, but it just slipped my mind. It's my birthday. So it closes on the 10th of December. Can I thank Dr. Day? Can I thank Professor Betts? Can I thank Dr. Justin Varney, but a special thank you to the staff who are in the background making this all happen, because without them it would not have gone so smoothly. So can I say to you all, good night, have a fantastic evening, and I think I'm going out for a meal now for my birthday. Bit late, but better late than never. Good night and thank you.